Glad to be here on a chilly Monday, 16 degrees in Washington, D.C., but we're here and we're hot. So, we're going to talk about today, is carpal tunnel syndrome. We get a lot of patients in our office that complain about pain in these three fingers. My thumb, first and second finger here. Carpal tunnel is the median nerve that gets pinched in the soft tissue within the tendons, near the bones, and my fingers go numb. I feel it primarily at night when I'm sleeping. My hand gets kind of caught underneath my bed. I wake up and my fingers are numb. So the carpal tunnel actually is the median nerve, and what we want to talk today is not only about the wrist, but we're going to talk about the elbow and the shoulder and the neck. We can get carpal tunnel not only from just repetitive typing at the computer, or just working in the kitchen, or doing writing all day long, but we can also get something called a double crush syndrome, where my neck is involved. I get pinching of these muscles, which causes pinching of the nerve. I can get a pinching in the foraminal, in the vertebrae, which is causing a pinching of the nerve. I can also get it from my pec squeezing my nerve here, my elbow squeezing my nerve here, and my wrist. So we're going to talk a little bit about how to stretch out some of those structures to open up the nerve, not only in the wrist, but your elbow, your shoulder, and your neck. Okay, so Sarah's going to start with some shoulder stretching. And she's got herself a nice jump stretch band. And she's winding up her latissimus muscle here. This is her lat, this is her tricep, this is her bicep. So what Sarah's doing is she's got her hand into this external rotation position where she's turning her thumb down. She's winding up her lat, she's stretching out her lat, she's stretching out her tricep, and all of these structures underneath her shoulder. Okay? So she's going to do this for about 3 to 5 deep breaths, and she's done. Structure stretching out, elbow, tricep, lat muscle, and all of these rib muscles here. Okay? So, come into the next one. She's going back into this external rotation position here. She's opening up her pec muscle here. So the pec minor, nerves come right underneath this pec minor and right on down the arm. So she's giving this a little stretch. She's opening up her bicep. She's externally rotating her hand here. So she's opening up these structures. I'm also going to ask her to take her neck into extension and look the opposite way. And she's going to open up these these foraminal structures here where the bones could possibly be squeezing the nerve. And she's going to open these up, so taking out some of this neck structure. Okay, so she's stretching her neck, her bicep, her pec, and structures down, keeping this external rotation position. All right, so we're going to get into the elbow now. Sarah's going to take another jump stretch band, and she's going to show us how to open up and stretch out the tricep and some of the elbow structures. So her hand is going to face the pole, and she's going to start some flossing exercises. I'm going to hold her hand so she doesn't move her hand. And what she's doing is she's getting some extension back into this elbow. So elbow extension is this, elbow flexion is this. So most of us lose this elbow extension due to sitting with the elbows in this flex position all day long. My bicep gets contracted, my tricep takes a vacation. So she's getting this tricep back into full extension, taking stress off of her elbow, hopefully finding another spot of compression on this medial nerve. Okay, so she's going to do this for 3 to 5 breaths again, or maybe even 2 minutes. Okay, you can take different positions with your hand. She can move her hand from here to here, which she did. She can move her hand from here to here, and just catch different positions. Catch the medial head of the tricep, the lateral head of the tricep, different positions in the elbow. Okay, so we're trying to floss these nerves and try to floss the muscles to get those nerves open again, all the way down to the wrist. Okay, last position that we're going to talk about today is flossing the wrist. So Sarah's going to come into the band again, down by the wrist. So this time her hand is faced away from the pole. She's going to grab her hand and she's going to shred or open up these tight muscles in the wrist. She's going to feel it here. So she's opening up the space where the median nerve is. She's also going to feel a little bit here. So what she's trying to do is she's trying to get full flexion and full extension out of that wrist. We spend a lot of time in this flex position in the wrist, so Sarah's trying to open up that position and get blood flow, nerve flow into that wrist. And she's going to do this for about 3 to 5 deep breaths also, or maybe even 2 minutes. All right, so that's it. That's it. I want to talk about today, carpal tunnel. A little bit about opening up the structures from the neck all the way down to the hand. Another good thing I could do, if we're going to talk about that carpal tunnel coming from the neck or the double crush coming from the neck, is I can just take my chin, I can do a chin retraction and then slightly look away. Slightly turn away, slightly look away, and I'm going to open up the nerves from my neck all the way down. Okay? So thanks for joining us, guys. Anyone suffering from this carpal tunnel, try to do these exercises every single day. In the morning before you get to work, after work. All right, we'll check in with you next time. Thanks for joining us.